it's Dr. Eloise Matthews. I'm a sports and exercise physician at Pinnacle Sports Physicians in Christchurch. I just wanted to chat to you today about the musculoskeletal manifestations of diabetes. I think this is a really important topic. Diabetes is really common in our population, and a lot of diabetes is undiagnosed. So you may have someone coming in to see you with a musculoskeletal complaint that is related to their underlying undiagnosed diabetes. And despite your best efforts, you may find that it's really difficult to manage their presenting complaint. And really that's because there's a metabolic process that's going on that we've missed along the way. So I think it's really important that we're all alert to this and that we're all thinking a little bit outside of the musculoskeletal square to make sure that we haven't missed things along the way. Common things that you might be seeing in your practice that could be related to an underlying metabolic disorder like diabetes. There are things like adhesive capsulitis, which we've all seen, so frozen shoulder. People with diabetes that have a 30% higher risk of getting a frozen shoulder. And because diabetes is so common, and because that is quite a high increased risk of developing adhesive capsulitis, I screen all my frozen shoulders to make sure that we haven't missed diabetes. The other condition that affects the shoulder that we do see more often in diabetics is calcific tendinopathy within the rotator cuff. Most commonly seen in supraspinatus, but certainly those with diabetes are at a higher risk of developing a calcific tendinopathy. In fact, those with diabetes are actually at a higher risk of developing any tendinopathy, which is important for you to keep in mind, particularly with the patient that has presented to you with multiple different tendinopathies, and you have to wonder whether there's an underlying metabolic process that is driving that. The other thing that we see commonly presenting when there is an underlying diabetic picture going on is changes to the pain system and how it responds. So chronic regional pain syndrome is seen at a higher rate in those with diabetes, and that's the type 1 chronic regional pain syndrome, which is the chronic regional pain syndrome that is not due to an underlying nerve injury. The other types of musculoskeletal concerns that we do see more often in diabetics, things such as chiroarthropathy, which affects the hands, DISH, which is a diffuse idiopathic skeletal hyperostosis, it affects the spine, and flexitinosynovitis, so a trigger finger process is also seen more commonly in diabetics, as well as Dupuytren's contractures. So quite a lot going on in the hands which can relate back to diabetes. The last thing I wanted to mention is the Charcot foot, which I'm sure the doctors that are listening will remember being drilled into them at medical school, because it's a diagnosis that's difficult to make and also one we don't want to miss. I hope that's interesting for you, and thanks very much for listening. We'll be back with further continuing professional development 5-minute sessions. Thanks, bye bye.